The findings from the recent study linking obstructive sleep apnea to damage in brain regions critical for memory should be taken as a serious warning, not just for those diagnosed with sleep apnea, but for the tens of millions who may be undiagnosed or underestimating the risks. While headlines tend to soften such stories with words like may or linked to, the implications here are far more dire than they might seem. This is not just about snoring or waking up groggy. It's about progressive, invisible brain damage that can rob people of their memories, their independence, and ultimately, their identities. Obstructive sleep apnea is already one of the most underdiagnosed medical conditions globally. Many brush it off as a minor inconvenience or a bad night's sleep. But what this study reveals is that each night of untreated apnea could be causing microinjuries to the brain, small, silent assaults that accumulate over time. The study, conducted on older adults without current cognitive impairment, found a direct correlation between the severity of oxygen deprivation during REM sleep and increased white matter hyperintensities, those bright spots on brain scans that are a hallmark of small vessel disease. These are not benign findings. White matter hyperintensities are strongly associated with stroke, dementia, and cognitive decline. Even more troubling is that the very areas affected, the hippocampus and the entorhinal cortex, are among the first to degenerate in Alzheimer's disease. These structures are not only essential for memory consolidation and retrieval, but also for spatial awareness and emotional regulation. Shrinking or damaging them, as shown in the study, directly translated to poor memory test performance, even in individuals not yet showing symptoms of cognitive dysfunction. This suggests that sleep apnea may not simply accompany age-related cognitive decline, it may actively drive it. We are looking at a sleep disorder that may serve as a silent accelerator of dementia, potentially starting years or even decades before diagnosis. And this risk is not confined to the elderly. Middle-aged adults with untreated apnea may be quietly developing these brain lesions without any obvious symptoms until it's too late. Brain tissue does not regenerate easily. Once these structures are compromised, it is extraordinarily difficult, if not impossible, to recover function. That means prevention and early detection are not optional. They are critical. But here's the even darker truth. Most people with sleep apnea don't even know they have it. The apnea may not always cause fully conscious awakenings. Partners may notice snoring, choking, or restlessness, but if the condition goes undiagnosed, the brain damage continues silently. The medical community has failed to make screening for sleep apnea as routine and urgent as it should be, especially in older adults or those at risk of cognitive decline. Primary care physicians often don't screen unless prompted, and insurance companies can make the diagnostic process expensive and inaccessible. This is a perfect storm: a widespread condition, poor public awareness, and a healthcare system unequipped to detect or treat it early. And the consequences? A likely surge in Alzheimer's cases, earlier onset of dementia, and millions of people experiencing cognitive decline that might have been preventable with timely intervention. There is also a disturbing inequality underlying this story. The study itself acknowledges that its participants were mostly white and Asian, meaning its findings may not reflect the experience of Black, Hispanic, and Indigenous populations, groups already at higher risk for both untreated sleep disorders and Alzheimer's disease. The lack of inclusion in this research reflects a broader systemic failure in how we prioritize brain health in underserved communities. If these populations are not even included in the research, how can we expect them to benefit from any eventual prevention strategies? Furthermore, let's not forget the psychological toll. People experiencing early cognitive impairment often don't know why it's happening. They blame stress, aging, or genetics. But imagine learning that it may have been caused or worsened by a treatable condition that went ignored. That betrayal is devastating. It means their suffering might have been mitigated, their future extended, their memories preserved. The implications are far-reaching. We need public health campaigns that treat sleep apnea with the same seriousness as hypertension or diabetes. We need automatic referrals for sleep studies in older adults or those with known risk factors. And we need to stop thinking of sleep as a luxury or a lifestyle choice and recognize it as a core determinant of long-term brain health. Make no mistake, what we're seeing here is a warning. Sleep apnea is not just a sleep problem. It is a brain disease in disguise. If left untreated, it quietly erodes the very parts of the brain that make us who we are. The danger is real. The damage is often irreversible. And the time to act is long before the first memory slips away.